Hey everyone, welcome to today's episode of the Medical Fitness Podcast, powered by the Medical Fitness Association and the Medicine Rehab Fitness Institute. My name's Jeff Young, and I'm a co-founder of the MRF Institute and an adjunct lecturer at CUNY, which stands for City University of New York, York College in Queens, New York. I'm co-hosting this episode with David Flench, President and CEO of the Medical Fitness Association. Hey, David.
Hey, Jeff, and hello, everyone. We are excited to have Ken Gorman on our show today. Ken is the Chief Executive Officer of Power Wellness. He holds a bachelor's degree in finance from the Wharton School of Business, and he founded Power Wellness in 1996. So he brings nearly 30 years of experience in healthcare development and operations. Power Wellness is the nation's largest management company in the medical fitness industry, managing over 50 fitness centers for healthcare systems, academic institutions, community foundations, and municipalities. Power Wellness is an industry partner for the MFA, and with Ken's leadership, they've committed to implementing the medical fitness model, operating 19 certified medical fitness centers. Hi, Ken. Thanks so much for joining us today.
Hey, David. Hey, Jeff. Thanks for having me today. It's a pleasure to join you both.
Looking forward to having a good conversation. Ken, maybe you can start off by telling us a little bit more about your role with Power Wellness and what your organizational goals and philosophies are.
Thanks, Dave. As I said, I've been so happy to join you here today. I've been really impressed with your podcast. You've had a talented array of speakers you've assembled over the last couple of years, and I'm sincerely humbled to join the ranks of these fantastic professionals. I view my primary role at Power Wellness as an internal catalyst, really to help our many talented fitness and wellness professionals maximize the impact of our clients' fitness, wellness, and rec centers. I think of the mission of Power Wellness as one to improve quality of life and improve overall population health. And we do this through innovative and scalable fitness and wellness programmings. I think the bulk of what we do is deliver our consulting and management services under a white label concept, and that leverages the trusted brands of our institutional clients along with our experienced professionals and proprietary tech. Our team members are always guided by 6 core values that are super important to us in kind of maintaining the breadth of our culture across 30 plus locations: integrity, creativity, passion, humanity, excellence, and humility. We are here to serve. We have a customer-centric foundation at our core. We're committed to achieving our clients' mission and meeting their members' needs. The growth of the company really has culminated in 2,200 team members serving 100,000 members at 30 medical fitness centers in 14 states. And the other day, I just ran the stats for 2024. We had over 5 million member visits in 2024.
Wow.
That is awesome. Hey, you mentioned the white label concept, and I was wondering, that's intriguing to me. So I was wondering if you could just dive a little deeper into that for a minute.
Sure. Ever since we founded the company, Jeff, white label and leveraging our clients' brands has been kind of a core foundation of what we believe the success of their centers has been. The Northwestern Medicine brand in Chicago, the Bon Secours Mercy Health brand, the Trinity Health brand. These are trusted healthcare systems in their communities, employing thousands of trained providers and clinicians and physicians in the process. And it's their business we're operating on their behalf. And it's not important who Power Wellness is. What's really important is that Trinity Health or Northwestern Medicine is committed to wellness and medical fitness.
So continuing with the question, since you're the founder and you're 30 years into it, Was this something that you realized would be a smart move from the beginning, or was this a learn as you go and you realized that the white label concept should be part of your overall approach sometime down the road?
Yeah, it's a great question, Jeff. It was core foundation from 30 years ago and remains
Wow.
important today. Uh, we emphasize our clients' brands on the badging of our team members. We recognize it, of course, in all the collateral. Even our proprietary programs that we'll talk about in a few minutes, MyFitRx, is not a power brand, right? We own the IP around it, but MyFitRx then is rebranded with the colors and the complementary aesthetics and brands of our clients when we use even a program like that across all 30 centers.
I have one last question on this, just because I really do find this topic intriguing. So, since you started off understanding that this was going to be part of your approach and your brand, is then that let's back up a little bit more and the Great Wharton Business School, is that something that you learned as part of your schooling?
Gosh, I wish Wharton would have taught me some of the lessons I had to learn early on. But they were great at sort of business plan models, and they were great at financial models. But it really didn't give me the school of hard knocks that we went through in the first 5 8
Okay.
building the business.
All
Uh,
right.
but it did give me a great foundation to learn quickly from my mistakes early on.
I'll tell you what, that is impressive. I'm going to switch gears a little bit and ask you a pretty, on the surface, simple, but a really important question. How can facilities maximize referrals? This is something I'm passionate about. How can facilities maximize referrals into their medically integrated programs?
Jeff, we spend so much time thinking about this issue and putting resources into it. I could probably spend a whole top podcast on it, but I'll try to break it down into why we think it's important and then what we're doing to accomplish the referrals. I'd start out with historically commercial fitness centers and even nonprofit fitness and rec centers served only 25% of the population. And therein lies the opportunity to impact a much larger group's quality of life. Our vision at Power Wellness is truly to expand the reach of our client centers to address two unique cohorts. Number one, the 75% of Americans who do not regularly engage in fitness. And number two, the 50% of Americans living with at least one chronic condition. These cohorts are both at risk and deconditioned, and simply put, they lack both the interest and the access. Our vision really is to change the paradigm. These two cohorts are not inclined to exercise for many reasons, but often cannot find appropriate facilities or programs for their needs. So at Power Wellness, we invested our resource to engage providers as part in this solution. Physicians and clinicians have long recognized the concept that exercise is medicine. Many physicians have encouraged their patients to change their lifestyle, exercise, eat right, improve sleep habits, but the behavior hasn't changed. In most cases, providers lack the local option to confidently refer a patient into a fitness solution. Compounding the problem, most patients left to their own means will not feel comfortable approaching a commercial fitness center, which targets usually a younger, more fit demographic. So what do we do about it? We have really a four-part strategy, Jeff. Number one, we offer an affordable and unified prescriptive fitness program. We call that MyFitRx that provides 10 entry pathways. This range from patients living with diabetes to patients who are going to have arthroplasty surgery. In addition, we developed an array of medically synergistic programs for other patient cohorts. This could be Parkinson's or multiple sclerosis. And these programs are administered by degreed and credentialed professionals with knowledge and expertise to support this at-risk deconditioned participant. Are you with me so far, Jeff?
Absolutely. Let me say real quick, my wife was diagnosed with multiple sclerosis, so that's close to my heart, but has pretty much reversed it through medical fitness. So keep
That's
going. This
awesome.
is great.
Yeah, no, that's awesome. But she wasn't going to be able to do that at a Planet Fitness, right?
Absolutely. That's exactly right.
Right. And so it takes
Couldn't
a
agree more.
unique professional and a unique center to kind of take care of folks like your wife. And I'm so glad she's in a stable place with that disease. So number two, then, we recruit and train a new type of professional we refer to as a wellness navigator. These degreed professionals serve as a liaison between the medical fitness center and the healthcare system. They communicate program offerings, they offer evidence-based research to the clinicians about the programs, and then they help onboard participants in the program. Third, we've deployed a really unique technology that connects the healthcare system's electronic health record system, in most cases that's called Epic, and the medical fitness center's member management system. These are separate systems. The EHR system really manages the healthcare needs in an inpatient and outpatient setting of that patient. But the medical fitness center is working in more of a retail operational system, right? It's collecting revenues, it's doing check-ins, it's doing scheduling of classes. So what this bi-directional technology does is facilitate referrals from providers downstream and fitness outcomes upstream from the medical fitness center. So that way, a physician or a clinician can easily refer their patient, and just like they will order a lab work, they can order a diabetes program or an MS program at the fitness center. The fitness center gets limited PHI, onboards the participant, and then uploads how that participant's doing back to their EHR. And all of this is accomplished in a secure, HIPAA compliant environment. Are you with me so far?
You're killing it. I love it.
Okay, so that's really unique because physicians, clinicians, they don't write paper scripts anymore. And even if they did, it's likely to end up on the floor of the patient's car spilled with coffee or something, right? So this kind of closes the loop on what the physician wants the patient to do and a way to get that patient onboarded into a program at the fitness center. Finally, what we do is we offer several technologies that efficiently and accurately collect fitness assessment data from the participants. So we have a baseline of when they start, and 8 weeks later, we see how they're coming along with multiple metabolic points. And all that data, again, is uploaded so the physician can see their progress at their next clinic visits. What's really cool is that the data is then shared with the individual and, of course, their physician so they can accurately understand where they're doing in their improvement. But more important, we can aggregate that data, eliminate, of course, references to patient names and PHI, and we can then demonstrate to the health system the larger population health trends that are going on, whether it's their diabetes patients that referred into the programs or, again, the arthroplasty patients. So in summary, these four strategies, we believe, have resulted in significant clinical outcomes from participants. One of the unexpected results, David and Jeff, however, was the membership growth. What we have seen on average is that 60% of the program graduates from MyFitRx join as long-term members. In short, they made a lifestyle change and they're sticking with it. So that's really exciting for us.
Yeah, I've been blocking David out, but let me just say one thing and then I'll let David chime in. This is great. You obviously look at the big picture and you see the problem with how you defined it with uh the chronic disease and the deconditioning and all that stuff that creates a problem. You moved into the entry points. If I followed you correctly, you moved into the all the points that you need to make this work. The entry points, the coordinator, the connection to the electronic health record, the data collection, and then all of the above led to greater membership.
Yeah,
Yeah, so this is awesome, man. It's very, very impressive.
thank you.
Yeah. One of the words that you mentioned right off the bat today was scalable. And having so many medical fitness centers across the country, and being able to scale what you're doing, I'm curious what you think have been the keys to that. I mean, you talked about some of the technology that's involved. I assume that's part of it. But talk a little bit more about how you and Power Wellness, your team has been able to really effectively scale it, because I've been in several of the facilities and they all run so well with the model, and it's just impressive to see the level of quality scaled across all of these.
Yeah, it's a great question, David. And we have a fantastic team of professionals from our wellness department, our wellness navigators, to the degree exercise physiologists on site that are really committed to that idea. We recognized early on that most hospitals that have one or even two medical fitness centers don't have the resources to kind of put a plan like this into place. They don't have maybe enough participants, they don't have enough support resources. And so we sort of said, in order to really make a difference, we can't just bring in, 50, 100 participants a year. We can't be tracking their progress on Excel spreadsheets, right? We can't have these, sort of paper-based approaches. We had to have a system to sort of unify the experience and then be able to replicate it. And most importantly, it had to be affordable. The problem with small scale programs, David, is they become too expensive to administer. And we knew if it's too expensive to administer, participants are not going to participate or payers are not going to participate in it, right? And so we had to make this really affordable. We'll get into that maybe in a few minutes of how we make wellness affordable and how we scale it. But on the scaling side, repeatable processes done the same way, efficiently delivered with the same technologies, using kind of best practices, whether it's ACSM, protocols or our own self-developed fitness assessments that are based on best practice in the industry. So doing the same thing, training people the same way allows you to then scale it and then allows you to really measure it, right? So now we can look at 30 locations with the same program and understand why one might be underperforming, why one might be better performing than another.
Yeah. The other part of what you kind of ended with was how one of the outcomes was growth of the membership, which is important to any kind of organization, really, the growth of their customer base. And I think, and Power Wellness operates facilities that are hospital owned and then some that are not hospital owned.
Right.
And so, membership growth is just so important across the board. And I think that as one of the outcomes that you're seeing, is fantastic. A lot of times I hear people who are hesitant or anxious maybe about the medical fitness model, and they think, oh, it's gonna cost me so much to implement this and change the way I'm doing things. And it's not going to be worth it. It's not going to have the return on investment that I'm looking for. And I think I've seen it completely dispel that type of theory. And I think what I'm hearing from you is when done right, this can be a financially successful endeavor to implement this type of model.
Well, absolutely. When you think about enrolling a member, we spend between 50 and $70 in marketing dollars to enroll a new member. That member hopefully is going to have a long, sticky relationship, 18, 24, 36 months, maybe 5, 6 years right at the center. And so it's worth the investment. If you can bring in a member from the medical fitness programming side, and they're enrolling in an 8-week program and 60% are staying on a membership, you just saved all of those marketing dollars, right, that you would have spent. What we also have found is that the graduates from these programs stay longer in the facility. Might have to do that something they're a little older to begin with. They're probably more settled in the community. They might not be as transient coming in and out of the community. But it also is the fact that they've made this lifestyle change that positively impacted a condition they might be, living with, arthritis or MS. And so they're more prone to stick with it because they see the quality of life changes more immediately.
And that demographic is probably part of that 75% who were not using facilities in the past like this.
Absolutely.
Yeah. So, going off of, operating both hospital-owned and not hospital-owned facilities, how do you think a fitness center can be uh, can be better recognized and utilized as a valuable component of the hospital's continuum of care?
Well, you make a great observation. we do a lot of analysis of what we call TAM, the total addressable market. From our observation and analysis, there's about 500 hospital-owned medical fitness centers of size and scale that are sort of community-based. However, there are over 2,500 municipality or nonprofit fitness centers. You sort of then consider that there's about 5,000 community hospitals in the US. This is a significant platform to help address the two cohorts I mentioned above. I previously talked about how we engage physicians to make referrals to their own health systems fitness centers. However, many hospitals don't have the capital to develop their own health and fitness center, particularly in recent years after COVID. Their margins are really challenged. So most healthcare leaders, however, have a strong interest in improving population health, along with the physicians who are working tirelessly addressing chronic conditions day in, day out for their patients. So we are working with our municipality and nonprofit clients to partner with local healthcare systems, partner with local physicians, and also partner with local payers to address their patient and their member needs. So let me kind of provide two case studies that I think are really interesting and fully scalable as you think about the breadth and depth of the healthcare system and the amount of existing municipal or nonprofit centers. In Rolla, Missouri, Power Wellness was retained by the city of Rolla to manage their 60,000 square foot recreation and aquatic center. The city leadership recognized the value of a partnership with local healthcare professionals. So over the last few years, we've worked to develop a relationship with the local hospital called Phelps Health. Phelps Health uses an electronic health record system known as Epic. We just completed an integration between the city of Rolla's rec center and the member management software there and the Phelps Health instance of Epic. This allows Phelps Health physicians to refer their patients to the recreation center programs. To my knowledge, this has never been accomplished. This is now an integrated tech between two different entities, a municipality and a privately owned healthcare system. And they've connected their systems together for the benefit of population health. The second example that's really interesting is in Albany, New York. Power Wellness manages the Colony Youth Center's 70,000 square foot rec and aquatic center. The Colony Youth Center is a private foundation in Albany. The foundation's leadership also recognized the value of a partnership, particularly with the local nonprofit health insurance company referred to as CDPHP, stands for the Capital District Physician Health Plan. For the past 5 years or so, CDPHP has incentivized their Medicare Advantage senior members, along with some of their commercial members and their young adults in those commercial members with weight challenges, to enroll in subsidized programs at the Colony Youth Center's rec centers. They refer them in, they help subsidize their participation in that because CDPHP recognized the value of trying to keep their senior members and some of the younger adults with weight challenges healthier. It helped their own bottom line and it helped the patients. These are both really interesting and repeatable models that could be done at thousands of these fitness and rec centers that are already operational nationwide. As I kind of coined it the other day, it's a triple win. The patients benefit by having a proven program that wasn't available through the commercial fitness side of the industry. The health systems or the payers are benefiting by cost-effective population health solutions, and the rec centers are benefiting by enhanced activity and increased membership.
I have a question, as someone who's a little bit on the outside. So, we're just getting to know each other, Ken. So I'm going to preface this question by saying I'm in my 30th year. And I spent most of my career actually, I'm currently an adjunct and I co-own the Medicine Rehab Fitness Institute and I wear several other hats. But for most of my career, I actually worked, like at Duke University is where I started. Duke University Medical Center is where I
Yeah.
started my career. I've been at UCLA Medical Center, Beth Israel, Mount Sinai here in New York City, and several private practices as well. So I'm definitely very familiar with being in the clinical setting. But now for the last few years, and it's really because of the pandemic, I had to reinvent myself a little bit. And so now I'm on the outside looking in. But my question is actually for both you and David. It's a little bit of an off the cuff question, but I just love listening to all this since I do have a familiarity with working in, big hospital systems and stuff like that. How are we going to take what you both are doing with Power Wellness and Medical Fitness Association and explode this so that the footprint becomes, like we just talked about, because it seems to me listening in that the capability is there. So how are we gonna explode this so there's a big footprint across the country?
Great question. David, you want to take a first shot at that?
Yeah, I mean, I'm interested to hear your perspectives on this too, but I think the timing is right at the current moment. The interest in medical fitness has started to really take off from what I'm seeing, and that in parallel. Is coming at a time where people are more interested in a holistic wellness solution. You hear about these types of things all the time in the general news, and so forth. So I think there's this interest in it, and then you have these examples that can be modeled across the country. I ran some facilities that I'm very proud of, are still doing some great things. Power Wellness, Ken's facilities, they're amazing to walk in. I've been into several of these. The Rolla, Missouri one, I was there, and I saw firsthand what he was talking about. It was interesting because you had a mixture of staff who had worked at the facility for a long time and others who were relatively new. And so you had an interesting dynamic of those who, had seen it as a rec center for so long, and then were trying to, understand and the whole medical fitness model, and then others that were newer, and that's all they were kind of seeing. But you kind of, it was nice to have both perspectives because your members also were in that, kind of environment where they were starting to understand some of the changes, and it was really neat to see that. So I think when you have some really good examples that can be modeled elsewhere, that's one way that this can start seeing some movement. As Ken mentioned, some of the statistics on the number of hospitals that are out there, and there are a lot more who could do this. And you don't have to build 100,000 square foot building to do it. You can in some markets that's appropriate. But you can have smaller operations. You can do it in a variety of different ways. We have certified facilities that are large, small, in between, doing great things. So I think the model doesn't require a major investment if that's not in the organization's plans. There are some who are looking hospital systems and communities who are looking at wellness, and providing health in a preventive way, as a strategic measure to improve their communities, to improve their organizations. So I think there are some who are putting a large investments into this, and so I think we're actually fairly early on this journey, but I think it's all happening. I see it as growth, definitely not a decline at this point. But Ken, what are your thoughts on all that?
The Medical Fitness Podcast is brought to you in part by the Medical Fitness Association. Are you a professional in the medical fitness industry? As a member of the Medical Fitness Association, you'll unlock exclusive networking opportunities with top experts in the field. Access cutting-edge education to stay ahead of industry trends and best practices. Don't miss out on the chance to advance your career. Join the Medical Fitness Association today. Visit medicalfitness.org to become a member. That's medicalfitness.org.
Well, I agree with you, David. And I'll give you an example. Phelps Health had other capital requirements. They weren't going to build a wellness center on their own, and nor in that community was it needed from a service standpoint. And so they had this fantastic facility that you certified, David, as part of the process that the city of Rolla owned. For under $50,000, we connected those two together and then put in place the programs that were needed to support, in this case, the MyFedRx pathways that I talked about earlier, right? So it wasn't a big investment in capital. It was a technology investment. It was obviously a staff investment at the center that Rolla owns, to have the right kind of degreed and certified professionals to administer the program. But that's scalable with the revenues of the program, right? You're gonna increase the staff as you increase more referrals into the program. So the medical fitness model doesn't need to replace what a current rec center or a YMCA or JCC is doing, or even a Planet Fitness might be doing. It could augment what they're doing by having new programs and the right type of staff to administer those programs. So it could be a new facility of 10 to 100,000 feet, or it could be programming in an existing operation that's already in the community.
I'm going to ask you another question, but before I do, let me just make one more comment on this. Excuse me. Just to give you a little bit more insight as to why I just love hearing what we're talking about and am very passionate about this. As you may know, the Physical Activity Alliance has developed a national physical activity plan that they've been kind of implementing behind the scenes and for the last 4 years, and it includes the professionalization of the fitness industry. So hopefully, a couple of years from now, uh, licensed clinicians within certain situations will be able to bill for the services of qualified qualified fitness professionals. And they're implementing this. All this stuff needs to be implemented at the state level. And as David knows, very recently I founded and I've launched a New York state level coalition of the that's implementing the Physical Activity Alliance's National Physical Activity Plan. And in our meetings, and by the way, the stakeholders we have right now that are interested, and this is brand new, it's only a couple months old, but we already have stakeholders across the public health, healthcare, fitness, education, and even mass media sectors. And so one of the things that we're talking about early on in our meetings is everything we're talking about in this podcast today, and the need to obviously increase physical activity in general, but also to reach out to the underserved, in rural or special populations, older adults, etc. And then I'll say one other thing. I'm a doctoral student right now as well. I'm pursuing an EDD in kinesiology, and as we speak, I'm building out my dissertation. And just to give you another or some more insight as to how passionate I am about this, my dissertation is going to be on kind of like at the clinician speaking to their patient standpoint, how to optimize the conversations that's going on and how to move patients in a structured and optimal way through that pathway into whether it's either rehab or medical fitness. And I'm going to be doing a lot of data collection on that, obviously, since it's going to be my dissertation project. So yes, I'm really passionate about this, and I just love hearing what you're all doing. And I hope that, well, I don't hope, I expect that this is going to grow and hopefully positively affect what I'm doing as well, to be honest with you, from a selfish standpoint, New York State and my dissertation.
That's fantastic, Jeff. I mean, that's the exact kind of thinking that we need from individuals like yourself around the country. I'd like to invite you to come to our leadership conference this October, and maybe you can speak about what you've learned so far and what you've written so far as part of the dissertation,
Oh,
because I think our team would be super interested in hearing
wow.
what your research has uncovered. So that would be so one opportunity. We get everyone together from a leadership of the whole company. There's about 90 of us all together for 3 days, and to have you speak about it would be fantastic.
Wow. All right. Well, guess what? I'm going to take you up on that. I'm gonna email you afterwards, and we'll hop on a Zoom call and we'll figure that out. But I really
That would be
appreciate it.
great.
Yeah.
Jeff does a lot of great work outside of like his main job. You know, this New York Moves coalition that he put together is one of the few that exists now. There's a couple other that came before, but I've tried to support him in any way that MFA can, and yeah, I think these are the kind of things that we need. We need, to be pulling together business, other community members, and doing it in this way to pull down the national physical activity plan to a state level and even a local level. And I think really a lot of the personnel at our medical fitness centers are good people to engage in these. I've looked at MFA, our regional committees, as one opportunity to push these types of coalitions forward. And I really think that, the connection to healthcare that a lot of our personnel have really sets us up to be able to help influence this type of work. So I'm really interested in how the progression of the New York Moves Coalition goes, and I'm interested in seeing it expand into other areas. So yeah, if power can be part of that conversation, that would be fantastic as well.
Absolutely. I really look forward to more discussions with you, Ken.
Great.
All right, that leads to my next question. And it's actually potentially my last question, unless I feel like chiming in again like I've been doing. But with the changing landscape of healthcare, it seems that patients are now more responsible of taking care of their own health. How do you promote or offer customized programs focused on chronic conditions that can help bridge the gap to wellness?
I love this question as a healthcare consumer and a healthcare provider. So thanks for asking it. Our vision is to provide affordable wellness programs that address unmet needs in a retail healthcare environment. So kind of unpacking that, we recognize that the average US consumer, right, is facing inflation, is facing tough rent numbers if they're renting, or the cost of living. And wellness is something they need to be able to afford. And unfortunately, Medicare and Medicaid and many commercial payers fund minimal, if any, fitness-related programs. So we need to make affordable wellness programs to meet this unmet need that we've talked about, recognizing that we have this retail healthcare environment. So as a result of all this, wellness investments have largely been left up to an individual, and that could include purchasing expensive WHOOP contracts or meeting with costly nutrition counselors. But that's not really how the average consumer is going to approach wellness. And those options aren't really available to them from a cost standpoint. So I think about how can we make wellness affordable, and we've come up really with three different strategies. Number one, our average monthly dues across 30 centers is $50. Now you'll say this is higher than a Planet Fitness model, and yes, it is. But it includes access to expansive clean amenities, including warm water therapy pools. It includes guidance from degreed or certified professionals. It includes a wide array of free programs that are available from youth to seniors, and features complimentary health education events. The second strategy to keep it affordable was really prescriptive fitness programs that we refer to, as I said earlier, MyFitRx. This is an 8-week small group program. It's not a one-on-one, but it's in small groups that costs less than $150 on average. And it is reimbursable to participants through their HSA or FSA, since it was conditional on a medical referral into the program. And in many cases, we've arranged for local subsidies from payers in the area. The third is really, we provide our members with complimentary access to a robust virtual fitness library and access to remote fitness coaches directly from their phone or tablet. So again, keeping dues low, having affordable prescriptive fitness programs, and giving them virtual fitness wherever they are, on screen, on site, to make sure they have fitness available to meet them where they are and do that really affordably.
Great strategy there. I've seen it in action, and it really works. Ken, I want to kind of wrap up the podcast today with a question, kind of bigger picture. Where do you see the biggest opportunities for medical fitness? wellness, population health in the next 3 to 5 years?
Oh, gosh, I wish I had a crystal ball for that one, David. Where do we begin? I would say there's really three areas that I think we need to focus on in the next 3 to 5 years to create opportunity. And this gets back a little bit to Jeff's question, right? Prior to COVID, there was a major push in the healthcare industry toward VBC, or value-based care. You can also include risk-based healthcare contracts. Given ongoing healthcare cost escalation and really the flat health outcomes that we're still experiencing as a nation, healthcare systems, CMS, commercial payers really are once again focused on this strategy. However, value-based care requires keeping individuals healthy for as long as possible, particularly in their later stages of life where we spend the most on healthcare. Medical fitness programs have the potential to help for all the reasons I mentioned above. And if we can make medical fitness part of the value-based care proposition, I think it could add a lot of value in the next few years. Maybe the second area where things will change the most is in virtual. Virtual healthcare and virtual wellness is now widely accepted among all demographics, including seniors. Technology has helped break down the physical barriers between providers and patients. Compounded by the high cost of construction and skilled healthcare labor shortage, virtual wellness will continue, in my opinion, to be an important strategy to improve access to lifestyle change in many parts of the country. We are right now taking the MyFitRx program, which has been so successful in on-site delivery, and putting that into an on-screen delivery. We just finished a really cool program at Rush Medical Center in Chicago, where their stroke patients are getting a virtual fitness class streamed right into their home, so they don't have to come to the fitness center in order to make progress with a medical fitness program. So when I think about how virtual wellness and virtual medical fitness programs can be delivered right into the homes, on screen, streaming, on demand, whatever works, right? I think will be accepted and is a great way to kind of push out into a much larger community well beyond the walls of the medical fitness centers. I think the third area that I see the greatest opportunity is with the Center for Medicare and Medicaid Services. We have to convince them that reimbursement for wellness programs that provide evidence-based outcomes and improve participant engagement is a cost-effective solution for these chronic diseases. To date, the data has been abstract and the programs have not been scalable for CMMS. Between our strategies and other industry leaders, Dave, I believe reimbursement is one of the biggest opportunities for medical fitness in the near future. So again, those three areas where I think will be the best, if we can tie into value-based care, if we continue to push the boundaries of virtual wellness and healthcare, and if we can engage CMS as part of a subsidy for the programs that are proven effective.
If I can chime in real quick, and
For
something
sure.
that you and I have in common, that's actually the virtual part is actually a major thing that I do within the Medicine Rehab Fitness Institute, offering virtual medical fitness services as well. So we won't get in. I'm putting a little plug in for that, and B, when we're off, and maybe in a future meeting or something like that, I can give you a little bit more insight into what we're doing, and maybe get your advice or just I don't know, figure out how we might be able to collaborate or something like that. But yeah, but it's a long-winded way of saying I couldn't agree more. And the I was in a Mount Sinai system here in New York City from 2006 as the founding fitness coordinator until 2016 when they blindsided us and shut us down, and then went into private practice. And then it was the pandemic that really, that's when the light bulbs, when everything went virtual, and that's when the light bulbs went off my head, and I was like, you know what? I can actually create a model where I can do a lot of what I did as a fitness coordinator in the hospital system, and I can offer a lot of these same things virtually. So needless to say, I agree with you, and we'll love to have future discussions with you on that topic.
Yeah, I think our director of wellness would love to have a conversation with you, Jeff, about that. And you'd enjoy hearing what he's doing, and I'm sure he'd enjoy hearing what you're doing.
Absolutely.
Ken, thanks for hitting on, especially that last question, some of those big opportunities coming we're starting to see some of them, and I think, yeah, definitely over the next 3 to 5 years, those are going to be some big ones. I completely agree with that. And thanks for sharing all of your insight today. We've almost been at it for an hour, and you've just shared a ton of great information. So I gotta thank you for being on the podcast.
Well, I'd like
Absolutely.
to thank you guys for having the podcast. I thank you for your passion to get this industry continued momentum along. And it's been a pleasure to be with you both today.
Hey, before we wrap up, and for our listeners' sake, can you know, how can our listeners like learn more about you, more about Power Wellness, maybe follow you if you happen to be active on social media or anything along those lines, and then we'll obviously make sure we put it in our show notes as well.
Sure. We've got a fantastic website, powerwellness.com. It's got some great thought leadership on it. We try to really take an industry leading position on it. It's not about what we're doing, it's about what should be happening and what we all can be doing. So along the lines of this podcast, how do we make this world better, improve life for everybody, and share that knowledge as transparently as possible. So please visit the website. I'm really active on LinkedIn, and please reach out to me on LinkedIn. Pretty easy to find, and we'll make sure that the LinkedIn site is available.
Absolutely. Hey, Ken, again, we're just getting to know each other, but it was great talking to you and listening to your insight. And I look forward to future discussions. And thanks so much for being on the show.
Have a great day.
Thanks a bunch, Ken.
This episode of the Medical Fitness Podcast is brought to you by the Medicine, Rehab, and Fitness Institute. The MRFI has been co-founded by medical, rehab, and fitness practitioners who see the medical necessity in getting people to be more active and fit. There is a sleeping giant of opportunity to building a more active population, an opportunity which lies in a more effective medical referral pathway to exercise programs and professionals equipped to serve that pathway. To learn more about our services and how we're working to make this a reality, visit mrfinstitute.org. That's mrfinstitute.org.